Hello, my name is Hanoon and I'm a media student studying in the US in Florida, and I'm from Oman. I'm 21 years old and I got diagnosed with acute porphyria. It all started when I was going back home in Oman for my Christmas break to spend those 2 weeks with my family and my friends, and I had my charity event because I have a charity here. So once I arrived in Dubai, I felt like there was something not normal the day I went shopping, because while I was shopping to buy stuff for the event that is gonna happen in Oman, I felt like I had abdominal pain, and suddenly out of nowhere I threw up, and it wasn't like food or nothing, it was just some green stuff, yellow stuff, which I thought it was weird. I took the drive from Dubai to my hometown, my home city, Muscat, the capital city of Oman. And throughout the drive, I was just in so much pain. I had so much abdominal pain, and I threw up again and again and again. And I just thought I probably got poisoned from the food on the plane or something, or probably because it was such a long flight, like 14 hours, I think. And when I arrived in Muscat, I told my mom, meet me at the hospital. I told my brothers too, and there was the time that I met them, and we met, and I was in the emergency room. I got admitted there, and the doctor said, okay, you have bacteria in your stomach, and they prescribed me some medications. Unfortunately, the medications that it was prescribed for me was not right medications, because it made my case worse. But I took what the doctors gave me. Anyways, I was so excited to be home because, I missed the food back home and stuff like that. And unfortunately, that was not the thing, like how I imagined my vacation would be, because every single day I would throw up and throw up and throw up. So I decided to stop eating and or reduce the amount of food I'm eating, just eat to survive, literally. So I was very exhausted. I had a lot of events. Being a social media influencer, I had to go to so many events. Being a founder of a charity, I had to prepare for this big event. I went through a lot of stress. I had, of course, low carb diet, and I was fasting most of the time because I was afraid to throw up. It was something really big for me, and I had so much pain when I was throwing up. Anyways, after my charity event, that's when it really became worse, because those medicines that were prescribed for me, they were not the right medicines, to the point that I was not even getting better, not even 1%. I was getting worse and worse and worse. So my mom advised me to stay home and delay my semester for school, and I was like, no, I'm not gonna do that. And I really wanted to go back to the US to finish my semester, so I'm not late like my friends. So when it was my last days in Oman, I started going to the doctors more and more to take glucose and to make me hydrated, to make me get all the things that I need as a human being to survive, because I couldn't eat. Everything that I would put in my mouth, literally I would throw it up. So I went to Dubai. I said goodbye to my family. I went to Dubai, and I had a transit there for a few hours, a couple of hours, and then I was supposed to fly to the US. But unfortunately, from there I had to delay my flight. I had to delay it for one day, but then I felt really nauseous and my stomach was hurting me, and I felt dizzy. I couldn't breathe. Once the plane landed, right when the plane landed, I could not breathe at all. And then the abdominal pain, all the acute porphyria symptoms were there, but I didn't know what was wrong with me. So the second part of the story is I had to delay my flight 1 time, 2 times, 3 times. Then I I decided to like delay it until like I don't know when, because I was sick, and every day my case was getting worse and worse, and the doctors didn't know what was wrong with me because everything was normal. Like, it came to a point that doctors told me that you should like see someone, as a specialist, a doctor, because maybe you're mentally ill, you're hallucinating the pain, there's nothing wrong, blah blah blah. I was like, no, there is some pain and I'm feeling it, and I was crying and I feel really bad, but people did not take it seriously, especially in hospitals, and that really made me very, very much pissed. So I was admitted in the ER for so many times, so many hospitals. In the end, they knew that this is not something normal and she should be admitted in the hospital. So I was admitted in the hospital, and at this point my case was really bad. I was admitted in the ICU because I got my first seizure, and it was actually New Year's Eve. I remember sitting in the bed. I can see Burj Khalifa, the tallest building, from my room, and I was seeing like people celebrating, hearing the noises and stuff, and that was when I first got my first seizure. My family had to drive from Muscat to Dubai, which it took them about like 4 hours, and I didn't know what the seizure was like, but I felt like there's something not normal and there's something bad about to happen. So I called my mom. I was holding her hand, and suddenly I really don't know what happened because I don't really remember, but it was so painful that I thought that I'm dying, and I started like thinking that I'm dying now. This is how death feels like. And then after 6 hours from that, the first day of 2018, I had my second seizure, which literally was 6 hours after the first one. And then I started having more seizures and more seizures and more seizures, and it was creepy and scary for me because I'm not really used to it. After that, the doctors did all possible tests they can do to know what's wrong for me. Any test you can think. Blood was taken away from me like every day, everything. They didn't know what was wrong with me. It's very complicated, it's very difficult to diagnose, but then finally one smart, intelligent doctor, he put the pieces of the puzzles together, and he was like, let's do for her the PPG test, I think it's called, the urine test, to see porphyria, and it was positive. I was tested positive, but it wasn't like, the blood test was not yet done, so they were not really sure if I have it 100%, but it was there in the urine test, so they thought, yeah, it's positive. They treated me with glucose and all the other things that I needed, but they didn't have the main thing to treat porphyria, which is the heme. So I was transferred to another hospital which provided me with the heme, and they did for me the blood test there, and it was in my blood plasma, and the porphyria was there. It was really bad and sad because I was, in a month, I was like, I'm not sure if the urine test said it's positive, but I'm still waiting for the blood test and blah blah blah. And it felt bad because I was between, I don't want to hear that I have porphyria because I'm going to have it for the rest of my life, and between being like, okay, I want to know what's wrong with me because I don't want to just stay like this. And I delayed a whole semester, and I was just sitting in bed, there's nothing to do. I tried to invest my time, do as much as things as possible. At the beginning I got depressed, but then I knew that I have to get used to it, especially once I came back home. And I found a doctor who is not specialist, but he knows how to diagnose. He had diagnosed porphyria before and treated other patients before me. And at that point I asked him and my mom, we heard that there were other porphyria patients that have porphyria. He said to us, unfortunately, I'm sorry to say this, but the 2 girls died. There's only 1 girl that is still living. And this was like a shock to me and my mom. And he told me something. He's like, the first thing you need to know is that you need to learn how to live with this disease. You're sick, you have porphyria, you're going to have it for the rest of your life. You need to learn how to live with it and occupy with it. It's kind of hard. I'm out of my attack now, kind of, but it's really hard, especially when you get those like severe pain and people think that you're just kidding or you're just joking, but you are really in pain. The porphyria slogan is think beyond obvious, and that's my advice. If you are diagnosed with porphyria, don't give up. Try to live your life normally. Don't feel depressed because you get your attacks. Try your best to stay away from the triggers. If you googled acute porphyria, there's a lot of information about it. You can find it in Google. Also, if you think you have like similar symptoms like seizures, numbness, weakness, and you lost, like me, I actually lost like 11 kilograms in 1 week, or 10 kilograms in 1 week, I can't really remember, and you get seizures and all these things, please go test yourself for porphyria. It's hard to diagnose, that's why a lot of doctors don't know. And doctors, please take it seriously. When you have patients with these symptoms, don't think that it's just because it's a rare disease, 1 in 75,000 people get it, that it's not out there. No, it is out there. I might be Middle Eastern, it's very rare in the world, and it's more rare in the Middle East, but it is there. So please take it seriously and never give up, and always think beyond obvious.